started your 2 minutes time. One more slide is there.
Yes, ma'am. Yes, ma'am. Next page, ma'am. Yes, ma'am. Ma'am, can I see the previous page, ma'am? Everything is okay.
Starting your 10 minutes time.
Yes, ma'am. Um, Hi, I'm Dr. Smriti. I'm the ST5 in the clinic today. May I know your name and age, please?
Yeah, I'm Helen. I'm 52-year-old.
Yes. And how may I call you?
You can call me Helen.
Okay. Okay, Helen, I see that you are here since you have irregular bleeding from down below, and also you have taken a biopsy of the lining of your womb, and you're here to discuss about the results. Am I right?
Yes.
Is there anything else you would like to? Is there any other concerns you would like to share with me?
No, doctor, I just wanted to know why this is happening and what is the treatment for this because I'm fed up of all these things.
Yes, Helen. I shall. I'm so sorry for you, Helen. I shall address all your concerns, but before that, can I ask you a few questions?
Okay. Why you
Helen,
are sorry, dear? Why you are sorry, doctor?
uh, you said you are fed up of. Okay, you're
Okay.
okay. So because of that, okay.
Yeah. Yes, doctor, I am really, it's getting very difficult day by day.
Yeah, okay. Can you tell me more about your irregular bleeding?
Yeah, doctor. Actually, I'm 52-year-old, and since last one year, and precisely since 6 months, it's so heavy, so erratic. At any time, it will come, and whenever the bleeding will come, oh God, I rush, I passes clots. Sometimes I need to take a leave also from my routine. Initially, I thought it could be because of the change I am going through, but then when it was not going getting relieved, I presented a GP, and he has then referred me to the consultant and who has done a biopsy for this.
Okay, okay. Mm. Yes. Do you okay. Yeah, I can understand what you're going through. Do you have any bleeding between your periods?
And sometimes I do get some spottings.
Okay. And do you experience any heaviness in your tummy?
No,
Okay. Any water work or your bowel work problems?
no,
Any pain in your tummy?
no,
Any offensive vaginal discharge from down below?
no.
Okay. Any recent unexplained weight loss?
No, doctor. I'm little on a chubbier side.
Oh, okay. And any loss of appetite?
No.
Okay. Uh, okay. And have you ever been pregnant before?
And yeah, doctor, I'm having a 25-year-old son, and
Okay.
he's into job now. He's grown up.
And are you sexually active, Helen?
Oh yeah, I'm married to John, and we do have a very good sexual life.
I would like to ask you a few intimate questions. Is that okay?
Yeah.
Any bleeding after sexual intercourse?
No.
Okay. Any pain or any problems during intercourse?
No.
Any history of sexually shared infections?
No.
Okay. Have you ever used any contraception?
Previously, before getting pregnant, I used pills, but after marriage, I was not on any contraception. In fact, I wanted to have more babies, but I couldn't able to conceive. Since I was little on a chubbier and they diagnosed me as a case of PCOS, I tried some treatment. It didn't work, so I just live half-heartedly.
Okay. Okay. Is there any other medical history of concern?
Yeah, I'm diagnosed as a case of diabetes and I'm on pills for that, but sugars are controlled.
Okay. Mm. Any surgeries, especially in your tummy or down below?
No,
Any family history of concern like cancers or clots, blood clots in your family?
no, my sisters are also little on a chubbier side and they are also diagnosed as a case of PCOS.
Okay. Okay. So this runs in your families. Okay.
Yeah,
Any, yeah. Any allergies?
no.
Okay. Are you well supported at home?
Oh yeah, my husband, my son, everybody is there.
Uh, are you updated with your cervical smears and are they normal?
Yeah, my smear was 6 months back and it is normal.
So are you aware of your weight to height ratio?
Yeah, it must be around 35. Little on a higher side, doctor. I'm a little bit chubby.
Are you aware of your blood group?
I don't know, but it was positive. I do not have any reservation for blood transfusion.
That's not a problem. Okay. And please don't mind, do you smoke?
Oh,
Okay. Alcohol, do you take alcohol?
occasionally a wine I do take.
Any recreational drugs?
No. Doctor, what do you think? At this age, am I going to use any recreational drug?
Okay. No, no. I just wanted to ask you just to be sure that I'm not missing anything. Okay. Are you on any medications, any herbal medications or anything of that sort?
No.
Okay, Helen. So I have gone through your reports and I have confirmed your name and NHS number. Um, actually, I would like to discuss with you a lot of information today. Would you like to have someone with you?
No, doctor, you can go ahead. My husband is out on a tour. You can go ahead.
Okay. Helen, actually, I do not have good news for you, Helen.
Why, doctor? Is there something very serious?
I'm afraid, Helen, yes. The report, which has been the biopsy that has been taken from the lining of your womb, it says that the cells they are not normal. There are features of cancer in your biopsy report, Helen.
Oh my God. You wanted to mean that these are cancer?
Uh,
Because I was expecting it could be some thickening or something like that. The consultant said, and he said that it might get normal with the help of some hormones, and I was hoping for that. How can it be,
yes,
doctor?
Helen. Yes, Helen. I wish
Are you
I did
yeah? Are
have.
you sure that this is
Yeah.
my report?
Oh, yes, Helen. I confirmed it with your name and your NHS number, Helen. Yeah.
Okay.
I really wish I had better news to tell you, Helen. this is.
Oh my God,
But
doctor,
Helen,
this is
yes,
really
but
shocking.
yeah, I'm so sorry for you, Helen. But there are treatment options for you, Helen. If you would like, I would discuss this with you.
Yeah, it's okay, doctor.
Okay. Okay. So, first of all, the cancer of your lining of the womb. Generally, people with certain risk factors have been found to have a higher incidence of this cancer of your womb. Some of those risk factors are being on the heavier side, uh, those with the diabetes. When there is a later age at menopause, that is more than 52 years of age, and also there are a few factors that are protective that prevents this cancer of the womb, which is usage of the pills or physical exercise. These have been proven to be uh, uh, um, to prevent the cancer. Helen, are you able to follow me?
Yeah, doctor. Now what, doctor?
Okay, so the next stage would be to find out the stage of your cancer. And the good news is that the biopsy report shows that it is a well differentiated cancer. That means it is a low grade cancer. And also, after in order to find out the stage of your cancer, we would have to take an MRI of your tummy, and also to check for whether there is any spread of the cancer. We would also be taking a chest X-ray. Uh, are you able to follow me, Helen?
Okay.
Okay. So it based on the stage after the investigations, if it is a low stage, I can assure you that the 5 year survival rate for a early stage cancer is more than 90%. So, and the definitive treatment for you is to go for surgery. Can I discuss with you about the surgery?
Okay.
Okay. So this surgery would involve a horizontal incision along your bikini line. It would be an open surgery, and it would involve removal of your womb, your tubes, and also the ovaries. This is called a staging laparotomy. And also any visible cancerous lesions would be removed. And there is something called lymph nodes, which acts as a filter for your blood. This is one of the first places where the cancer cells would be spread. So we would be doing a selective lymph node removal. Are you able to follow me, Helen?
Yeah.
And also, Helen, you would be under a specialist team of doctors, which would involve the oncologist. Oncologist is a cancer surgeon and a gynecological cancer surgeon, and also a specialist cancer nurse would be involved in your care, Helen. Um,
Okay. When are you going to start this treatment, doctor? I'm really.
Yes, you would be urgently referred to a cancer specialist, and all your investigations would be done urgently. And the next would be to go for surgery. You would be seen by a sleep specialist, that is who would give would be involved in putting you to sleep during the surgery, and he would evaluate you for fitness for surgery. And also we would be doing a few blood tests and other investigations which would be required to check for your about your fitness for surgery. And just like any other surgery, there are a few complications associated with this surgery as well. Some of the few frequent complications are infection and bleeding, and there are a few uncommon complications like injury to your bladder, to your waterworks or your bladder works. And a detailed description about this surgery would be given to you just before planning for your surgery. Are you able to follow me?
Okay.
Okay. And after the surgery, the tissue will be sent for a microscopic examination. From this, the definitive stage of your cancer would be, we would get the definitive stage. And if it is an early stage cancer, then we would not require any further treatment. But if it is a little advanced, based on that, your cancer doctor would suggest you for either radiation or chemotherapy based on your stage. This will be discussed with you in detail by the cancer doctor. Helen, are you able to follow me?
Yeah, doctor, it's really
Yes.
difficult actually. It's quite overwhelming for me to
Yes, I
absorb so
can.
much of
Yes,
information.
yes. I shall give you a contact of a few support groups and also a counselor who would be able to help you to deal with this situation. Your support groups are people who are in the same situation as you, who have crossed this stage. So they would be able to help you and advise you on how to manage the situation. And also, there are counselors who would be able to support you in this situation. We would give you the optimum best treatment possible for you, Helen.
Yeah, doctor, thank you.
Okay. Okay. I should also give you written information about your cancer, and I shall write back to your GP. And I should also fix a follow-up appointment with my consultant to discuss about the further management. Do you have any other questions, Helen?
Oh, that, thank you.
Okay. Thank you, Helen.
Thank you. Okay, Dr. Smriti, your own reflection.
Ma'am,
Yeah, your own reflection.
actually, I did better than the previous.
Okay. Yeah. You need to practice, dear. Unless and until you will not practice, you will not come up. You will not come out. Practice more, more, more. Then only you will able to come out of that fear and do it very precisely.
Yes, ma'am.
Okay, unless and until means it is basically we are new. We have not come across such scenario, such situation in our day-to-day clinical practice, and that's the reason we are having difficulty in presenting this task. Okay,
Yes, ma'am.
otherwise when it comes to management, we know what is the management for this patient. Okay,
Yes, ma'am.
the knowledge part is absolutely fine. I do not have any issue. It is actually a speed with which you have to complete the task because whatever you had said, you have to complete it within 10 minutes. Only relevant history because only relevant history. Okay, so
Yes, ma'am.
practice more and more for that. That is what
Yes,
my
ma'am.
presentation. Now coming to the feedback, what I am getting,
Yes, ma'am.
it is only time management. Okay,
Okay, ma'am.
time management and saying okay, okay, okay too many time. Why you went into the sexual history so detailed, dear? I didn't understand. What is the significance of sexual history in this case? In vulval cancer, only sexual history is important. In rest of and in cervical cancer, because those are associated with HPV. Okay, in other cancers, it is not needed. Uh, Asking a recreational drug in an elderly patient is totally no, a big no,
Okay, ma'am. Okay, ma'am.
because it is not going to. They are not going to have a recreational drugs. Basically, the recreational drug comes up in a abusive SRH module, abuse module,
Mm.
antenatal care module. Those two, three modules only you need to ask that history, not in every module.
Okay, ma'am.
Urogyney and onco module, skip it, skip it. Do not follow a routine template for each and every module.
Okay,
There
ma'am.
is a modulation of template for each type. Okay, here the sexual history is not important here. Here the risk factor. Other than that, you would have asked you, are you on any hormone replacement therapy or any other alternative medications? Your BMI, smear you asked very lately, dear. Hmm? So those risk factor history is very important. PCOS, did you recognize that PCOS is one of the risk factor in her case?
Yes, ma'am. I've written. I
It,
didn't.
yeah, but did you communicate with the patient?
Yes, ma'am. I should have told.
Yeah, so that is communication with the patient when you come, it comes to explaining. So you
Mm.
very, I mean, the way actually still you were able to communicate with me in a better way. I do not have anything to say. You followed then after the information gathering, which took almost 7 minutes 20 seconds. After that, you went into the discussion of report. Whenever you wanted to discuss a report, please ask role player, is she aware about the report? She will not be. If she is aware, then it will not be BBM. Always remember. What if I am aware about this report? Will
Okay.
it be BBM?
Ma'am? Sorry?
Will it be, yeah, will it be a breaking bad news?
No, no, no.
Yes. So that's the reason checking background knowledge is very important. What I know. No, I don't know anything, doctor. The consultant last time said that it might be some thickening, and it will get cured by some medication or some hormones. Okay, so it is very
Mhm.
important. You followed the BBN template, but you need to practice. You need to
Yes, ma'am.
practice more and more for this kind of communicative task. Once you had delivered the BBN, you paused actually, but the next
Mm.
sentence is yes, I means will it be okay to continue, or will like to end this discussion as of now and arrange another appointment with my consultant along with your partner.
Okay.
Okay, if there will be lay, that might be having a marks. So do
Okay.
not rush into the management task or managing a patient. Please pause and ask whether it's okay to continue or reschedule the appointment. And then
Mm.
coming to the options. Okay, very nicely you had mentioned that 2 week pathway. No, you mentioned urgent, urgent twice. It is not
Mm.
urgent. It's 2 week pathway or targeted pathway, which you have to say. MDT, yes, cancer MDT. Counselor will be a part of this journey. Did you mention counselor?
Yes, ma'am. I mentioned.
You mentioned listen about support group,
I
PIL,
told it at the end, ma'am.
okay, and
I
PIL.
didn't tell it as MDT, but I told it in the end. PIL, yes, ma'am. I told everything I told at the
Yeah,
end.
yeah, you mentioned. So, counselor, I didn't listen to counselor. MDT, I listened. MDT, you mentioned. Okay. There are people of different clinical expertise: cancer specialist, gynecologist, radiologist, tissue doctor, cancer nurse specialist. This will
Mm.
all meet up and formulate a best possible plan for you. It is not staging laparotomy, it is a surgery, either a keyhole or open surgery. Staging laparotomy, where you are going to do?
Ovarian cancer.
Yes. Here it will be a surgery where we will be removing both the ovaries along with the uterus and tubes. And
Okay.
if plus minus lymph node assessment removal, plus minus, we are not very sure. It will be depending upon the MRI and MDT decision.
Yes,
Yes,
ma'am.
very nicely you mentioned that this seems to be a well differentiated adenocarcinoma, but as of now, we do not know the stage.
Yes,
For
ma'am.
staging it, we need to have MRI, X-ray chest, and the tissue test.
Okay.
And most of the time, this here you can just use that sentence that most of the times cancer lining of the womb gets detected at an earlier stages and having a very good prognosis, which you had mentioned. Okay, seven
Mm.
out of 10 women will be having a very good survival rate chance, which you had mentioned. Okay,
Yes.
uh, 7 or 9 you mentioned.
I said 9, ma'am.
Okay, 9 you mentioned. Uh, okay. Then chest X-ray urgent 2 week pathway you mentioned, and then you communicated, and you had given me appropriate plans, staging laparotomy, lymph plus minus lymph node dissection, then tissue testing, staging
Mm.
after that, and plus minus chemotherapy or radiotherapy. It all depends upon the staging. Okay.
Yes, ma'am.
So all these points you need to combine within that 10 minutes time. To be very precise, 9 minutes. For that,
Mm.
you need to have a very good practice. So now
Okay.
onward, you will be practicing, dear. Huh?
Yes,
Practice
ma'am.
more and more, more and more. So incoming post DNC or post pupil biopsy. So coming to my answer key,
Mm. Yes,
introduction,
ma'am.
patient identity confirmation, situational awareness is basically you are discussing a report. Aim, Helen, we are here to discuss the tissue test report. It's not in hurry, basically it's after 2 weeks. Okay, are you
Mm.
aware about the report? Here also you can ask, if not while
Mm.
discussing the report also
Yes,
ask.
yes. Okay,
So
ma'am.
we will be asking a few questions to formulate a safe management plan for you. I use simple sentences, I do not go into the details. Any specific concerns? No, I just wanted to know the deep report, and then I just wanted to get rid of all these symptoms. That is my first concern. Okay, then I do have some other concerns which will be coming up eventually. Menstrual history is very important here. Okay, so symptoms of C endometrium will be periods, heavy, IMB, PCB, smear, contraception. In the beginning only you can ask what treatment she has tried. Okay, Weight loss, loss of appetite is also important. So this much history is important.
Uh,
No sexual history, dyspareunia, pain, STI, these are not relevant here. Now coming to
okay.
the risk factor. BMI, hormone replacement therapy, any alternative medication, blood pressure, blood sugars, family history of cancer. These are the risk factor. This risk factor history is important. And allergy. Ops history, I see whenever I wanted to give you the detailed history, and I do not want to keep any channel open for the next question. I used to give you a full history. No further history is needed. Ops history also, I told you regarding PCOS history. I told you regarding, I tried but then I left, I mean quit. Personal history, smoking and alcohol, no drugs are needed. Okay, support is very important, whether she's having adequate support at home. Checking background knowledge whenever you wanted to discuss the report with the patient is very important. Any idea about the report? Do you wish to have someone along with you? These are your reports. I just confirm by your name and NHS number. Some serious concern, sinister pathology in your report. Tissue doctor notate cancer of the lining of the womb along with small fibroid and normal neck of the cervix. Okay, this is a complete report.
Okay.
Hmm? This is a complete report. Uh, No, this was actually adenocarcinoma. This was fibroid was not there. This was some other report. Okay. So
Yes.
the report is actually the noted a cancer of the lining of the womb along with a normal other tissues, not other
Okay.
tissues. This was actually Lisa task. Okay.
Oh, okay.
Just cap copy pasted here.
Yes.
Lining of the womb. So pause, give her a time, ask her whether it is okay to continue or do you wish to halt it and have another appointment. Okay.
Yes. Okay. Okay.
No reassurance, which you didn't reassure. Okay. Now it's a difficult news to have, but this type of cancer is having a good outcome, and most of the time these are getting detected earlier. Hmm?
Yes, ma'am.
So now to find out what stage you are, we need to evaluate you further by MRI and X-ray chest also, as you rightly mentioned. Okay,
Mm.
X-ray, or they are saying even CT chest also they do.
Yes, ma'am.
CT abdomen and CT chest also. So whatever modality, if you in early stages, then having a good prognosis. More than 7 in 10. Okay, woman with diagnosed endometrial or uterine cancer in England survive 10 years or more if it is predicted. It is predicted, okay, or it is
Mm.
diagnosed early, as it is diagnosed early. Cancer MDT. Now, cancer MDT components we are going to say: consultant, tissue doctor, imaging doctor, Macmillan cancer nurse, counselor as emotionally very draining. This 2 week pathway you have to say, dear, okay? Not
Yes.
urgently. Targeted pathway or 2 week pathway. MRI for assessing the depth of invasion and further plan will be followed up. Other tests will be see to check how the body is functioning. Surgery is the recommend definitive. Okay, you said a definitive treatment will be surgery. No, it
Mm.
is not definitive. The surgery is the recommended modality of management. It will not be definitive. It will be recommended modality of management at whatever stage of this CA endometrium she will be. Okay, which involves womb and ovaries removal, either keyhole or open surgery.
Yes, ma'am.
Yeah. In your case, we may just follow up with MRI and see any abnormalities noted, act accordingly. MRI is only explain as spread. Final report will be by tissue test. Okay. Final staging will be by tissue test. If early stage 1 low risk cancer, then less likely you will be needed radiation or chemotherapy. If it is advanced cancer, then the chances of requiring radiation and chemotherapy is more. Mm? And that will be decided by the MDT. Okay. Uh, we as of now we do not know, but earlier stages, good differentiated carcinoma or cancer will have a very good prognosis, so less likely you will be requiring a radiation and chemotherapy. But if it is advanced, then chemotherapy or radiation therapy will be needed, which will be decided by MDT. It is overwhelming. It involves lots of ups and downs. So Macmillan Cancer Support Network, Macmillan Cancer Nurse Specialist, counselor will be part of your journey. Hmm?
Yes, ma'am.
and all endometrial cancer, they generally see to see whether there are any genetic linkage, so they can be referred to the geneticist. Any other concerns? Am I going to die? This was another concerns. Generally, this cancer is having a good prognosis, as you had already mentioned that nine, but the sentence is 7 out of 10 women can have a very good prognosis, and they can have a life up to 10 years post detection, died, detected earlier. Okay, so these sentences can be used there. Give you PI, and then concerns are multiple concerns. So here my concerns are what causes cancer in the womb. The various risk factors are high BMI, PCOS, late menopause, as you rightly said. Okay, late menopause, nulli gravida. These are the risk factor associated with cancer, diabetes and hypertension. Okay, diabetes and high blood pressure. These are the risk factor. Stage we will come to know once the tissue testing will be completed and MRI will be done. MRI
Yes,
will
ma'am.
be done, then only we can at least predict the stage. Treatment is surgery followed by chemotherapy or radiotherapy depending upon the stage of the disease. Outlook, good prognosis. Okay.
Yes,
Uh,
ma'am.
Preparing myself for worse, no, less likely, because these cancers are getting detected earlier, they presented earlier, and most of the time these cancers are having a very good prognosis. Is there any guarantee that everything will be removed? In this cancer, whatever abnormal tissues and lymph nodes will be seen, that those tissues will be removed whenever we will be offering you surgery. Okay, so these
Yes.
are the concerns what we had discussed one by one, and then close the station. So documenting her care plan, arranging MDT, arranging MRI, and a follow-up 2 week pathway should be the timeline for this case. Within 4 weeks time, she should be on table for hysterectomy. Yes.
Okay. Yes, ma'am.
Okay. Now coming to information gathering, interpretation of reports and knowledge information which given, asked to review notes or states that you will review notes whenever more information is needed regarding the endometrial cancer. If she is having any previous conditions like PCOS or something like that, that can be reviewed. Obtain the history of pattern of menstrual. So menstrual history is very important. Risk factor history is very important. Smear history is very important. Fear, concerns, treatment, right? So she has tried directly biopsy. She has not tried any over the counter medication, hormonal treatment. Okay. RP is concern, fear, expectation, checking background knowledge at a frequent interval, and arrange investigation. Information gathering will be again, you are going to gather a further information regarding staging by arranging MRI.
Yes, ma'am.
Communication with patient, explain the diagnosis in simple lay language. Basically, breaking bad news is very important. Anxious to sensitive and BBN approach. What investigation she is going to need, what treatment she is going to need, histological staging. So, what she will be expecting, means how the staging will be done. Prognosis, if early, very good. That also comes under communication with patient and family. Refer to oncologist, cancer specialist for MDT. Provide support, explaining in lay language what HPR mentioned. HPR means whatever test, whatever the tissue test or a biopsy report has mentioned in lay language, which you had mentioned. Uh, Clearly mention cancer. Do not say or do not go round and round explaining that this is sinister pathology, this is serious concern.
Yes, ma'am.
Clearly mention this is cancer in cancer conditions, and clearly mention precancerous whenever there are pre-malignant condition, because it is very important. Because okay, if you are saying, keep on saying sinister pathology, the role player might ask, okay doctor, it's sinister pathology but it's not cancer. Okay, so do not make a mistake like that.
Okay.
Patient safety, confirm identity, signposting, no reassurance. Waiting time, how much? So here the waiting time is targeted pathway, that is 2 week, 4 week. Principles of cancer MDT, timing of surgery, fitness of the surgery, provide appropriate empowerment to inform choices on the treatment. Here actually the recommended modality is surgery. It was not a negotiation task, so recommended modality is surgery. Allergies, no allergies is here. MRI shows evidence of lymphadenopathy, then it needs to be assessed and guided accordingly. In answer to her questions about further treatment, competent candidate should explain that this will depend upon many factors. Okay, she will require radiotherapy or chemotherapy, that will be required, depends upon many factors. And whenever the patient is all alone, always ensure that she will be with someone. You can ask whether she can contact her partner, or you can contact someone on her behalf, so that she will not be feeling lonely or something like that. Okay, so sometimes that is also coming under patient safety domain. Sometimes, not always. In such situations, okay. Applied clinical knowledge is basically knowledge, interpretation of report, then explaining type of endometrial cancer, and it is the best type, best prognosis type. What investigation we are going to know, we are going to need it. How is the survival, 5-year survival rates in the region of 90%? Okay, so you mentioned 5-year survival rate is 90%, and what I
Yes,
had mentioned is 10-year survival rate is 70%. Okay,
yes.
that is also from that NHS, means cancer UK network site only.
Okay.
Prognosis 5-year, which depends on stage, but is generally very good for early stage. Explain the need to review determining adjuvant therapy after surgery, which you mentioned. Follow up. Okay, so after the procedure only, we will be following up with you accordingly. Communication with colleague is MDT, feedback to GP, and cancer support team. This is actually communication with colleague. Okay, so overall, yes, you have done a good job, but you need to practice, dear. More
Yes,
and
ma'am.
more you will be practicing, you will be more and more, means your communication will be more and more smooth. That is what my observation.
Yes, ma'am.
Okay.
Okay, ma'am.
So we will be ending this task. We will be going to the next task.